Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Locally advanced metastatic renal cell carcinoma. Already it is advanced and there is metastasis also. So in this case, we can do radical nephrectomy, but the best treatment or first line treatment in this condition is sunitinib or chemotherapy, because we can do radical nephrectomy. We do radical nephrectomy and we will debulk the tumor, but the main treatment option is chemotherapy. So in the chemotherapy, first we will start with immunotherapy, that is we give sunitinib is the first line treatment for metastatic renal cell carcinoma. Then we can give combined interleukin 2 and interferon alpha are the second line treatment for metastatic renal cell carcinoma. First line is sunitinib, second line is interleukin 2 and interferon alpha. Then chemotherapy can be done with vinblastine. Chemotherapy with vinblastine is the single most effective agent for chemotherapy. Then always we should remove the thrombus if there is renal or intravenous extension is positive. If there is renal or inferior vena cava extension, if there is renal vein extension or inferior vena cava extension, then it is better to remove the thrombosis. Radiotherapy is done if there is symptomatic bone metastasis. So for symptomatic bone metastasis, we do radiotherapy. We give sunitinib as first line, interleukin 2 and interferon alpha as second line. Vinblastine is given for chemotherapy, and if there is renal vein or inferior vena cava extension, we can remove the thrombus.
thank you and thank you for watching.